start with a question to.
Full disclosure, I didn't get these ahead of time, so.
We didn't have time to share, but let's try. So one of the things that intrigued me is your multi-channel education, let's say, platform. And the question that I was asking myself is, how do you orchestrate this multi-channel, let's say, communication and education strategy? So do you use LLM, or do you have protocols that enable that? So can you expand on that?
Yeah, we have protocols. We use a CRM, so customer relationship management software. Ours was built on Microsoft Dynamics, no offense. But it was essentially what it does is it allows you to kind of build and integrate into the medical chart important educational, medical data, medication, as well as notes from clinical staff so that we can make sure that everybody's on the same page about what's happening next, what needs to happen, orchestrating all of that. In that current version of the study, we ran the study mostly unfortunately, over COVID, so it was 2021 to 2023, and LLMs had not quite hit their stride at that point. Integrating LLMs into medical enterprise, data security, HIPAA compliance, all that fun stuff does take some time. We have been able to achieve that in a lot of the work that we're doing now, but it was mostly protocolized education, handled through a CRM that was, again, enterprise. One thing that's important, again, whenever you're managing patients and dealing with patient data, we did have to get consent for anything that was not through the secure patient gateway, a HIPAA-compliant channel, unless you're faxing stuff to and from your patients, which I hope nobody's doing anymore. You really have to just either get their permission to use things like email or text message, which are by default not HIPAA-compliant channels for communication, and otherwise they would be going through the patient gateway.
Thank you very much. Angela, I think that one of the biggest challenges in scaling up the usage of clinical support, decision support system is, let's say, the fact that, for example, EMR are not, let's say, they don't have the same data model, or let's say the readiness of the IT systems locally might not be at the stage of being able to incorporate AI, or even cultural reluctance in going through the cloud. So you have a perspective of a global company. So how do you see these problems around the different regions, and how you address that?
Well, one of the things I saw today that I really liked is the fact that we started with education and learning how to use models and learning that there are different models, and understanding that there's the opportunity in learning that there are different models, how to use them. The fact that you could use education through RRI or through your specialty society or any academic institution, and then that much of that education is free to understand how to use it. So that's one thing. Where are you on the scale of being educated about what's happening with AI and agentic AI? The next would be looking at the electronic health record that you're using. Every single one of the electronic health records has a roadmap of where they're headed, what they're looking at, what they're going to be using to understand that. I'll tell you right now, your IT department, your informaticists know exactly where they're headed, and they've got a strategy there. And if you recall from my presentation, I talked about what if you get to decide, meaning that you're part of the conversation about where you're going to go next and what information is most impactful. You can't do everything, you can't boil the ocean, so having the education, that baseline understanding, being able to increase that over time, and then working with your IT and informatics department to understand even more. And then to have more and more education as it relates to models. There are many different models out there. You want to be able to use the right model for the right application, being able to have that choice and to understand them, so as you're utilizing tools, you know which tool is best for what you want to do. Is it an operational efficiency play? Is it one that's based on engagement? So understanding how they've been trained and how advanced that particular model is will help you do that. So I think those are all the ways. Your own education, understanding what your organization wants to do, then understanding what you want to do, that helps you kind of to be able to use these tools and to move faster.
Thank you. Coming back to you, Alexander, you presented results on, let's say, the sustained improvement on intermediate outcomes. So have you looked also at patient-centered outcomes like hospitalization, mortality, or quality of life? Do you have data on that?
We don't have quality of life data. We are, as you know, that one of the major challenges with focusing on blood pressure and cholesterol is it takes time to accrue events, even with significant reductions. So we are starting to gather outcome data, more kind of hard outcome, heart attack, stroke, hospitalization, heart failure, things like that. And that's work that we're looking to publish in the next couple of months. So,
okay, so
yeah.
we will stay tuned,
Yeah.
waiting your results. So coming back to you, you tangentially touched on, let's say, the usage of agentic AI and predictive algorithms to improve workflows. So how do you see the cooperation between agentic AI and traditional machine learning predictive models in the future? So how do you see them working together?
I think the biggest difference now is you're going to see like all this information, all of a sudden it's very actionable. It's much more intelligent. Agentic AI means that there's an action that goes along with that information right now. Right now you're getting it all. It's being, like I said, characterized, plotted for you. But what's next? Now with agentic AI, it's going to be an action that goes along with it. Certainly an action that you've put in place. It's an algorithm that makes sense. It's a standardized best practice for patient care. But at least it's next. And it also will be able to anticipate what might be needed. What other study might be needed? What other piece of information? What data needs to be pulled from the massive data sources that you have? So it really is about having actionable insights at your fingertips that are allowing you to take better care of patients. It's advancing the care.
Thank you. Alexander, you presented your LLM, let's say, tool to speed up enrollment for clinical trials. And you mentioned that the main motivation was that, well, let's say, using coded information might not be sufficiently specific. But seeing your graphs, it seems also that AI was also more sensitive because you had not only a faster enrollment, but let's say at the end, you enroll more patients there. Have you thought of using these models also to, let's say, find undocumented comorbidities to expand, let's say, the coverage of, let's say, structured data in your databases?
It's a great question. Yes, we are starting to use this now for many other use cases. So I was fortunate to be in a position where I had a pain point. I had a technology team as part of my research group that could help me expand and build on this tool. We're now not only using it across our enterprise for other research studies, that's in a beta program, but we've essentially kind of let this out to other research groups and operational and finance groups who are also finding really interesting use cases. Because as you can imagine, we've essentially built as a system that can rapidly, accurately, and cost-efficiently ask and answer questions of unstructured medical data. For a long time, that's been a Pandora's box, and there's still a lot of information that we're learning from that. But we're seeing use cases that are as varied as clinical referral triage. So, some of the groups that are starting to use this tool get a lot of referrals, and some of them are very urgent. They need a procedure in the next week or the next month, and some of them are, I want a fourth opinion about this medication that I might want to try. And not that it's not urgent, they're all important, but I think there certainly is clinical and procedural urgency that sometimes trumps, we need to see these people soon. So we're seeing it across some of those use cases. We're seeing it in quality and safety. So how can you benchmark clinicians against one another in terms of not just how are they coding and how are they billing, but how are they doing in terms of safety and quality metrics? Normally that takes a lot of analyst time. That's a lot of, and it's rarely reproducible either across divisions or across hospitals or health systems. So being able to use unstructured medical data to assess that is actually very valuable because that's then a tool that you don't need to have proprietary access to their back-end EHR to plug into the data fields that you need to actually run the analysis. You can say, look, all I need to touch are your notes, and I can look at all sorts of things like safety, quality, efficiency. I can compare those as benchmarks across the doctors in this hospital, but the doctors in the 5 other hospitals in this system, and I can understand practice patterns and how those are changing across these different groups. So we're seeing some really interesting use cases, and I think that's one of the fun things that comes of a beta program. You're not even really sure what other people are going to come up with. So revenue cycle management is a very hot area in AI, just because that's a very tangible way that there's some opportunity to recapture value for health systems that are struggling for every dollar sometimes in this day and age. But I think there's a really wide breadth of interesting use cases that we're starting to see from research and operational groups and teams across the organization.
Thank you very much. If there is no further
Okay,
question.
I have one quick question.
Sure.
Angela, actually, it's a question for you. When we were talking first, you mentioned something to me that really stuck in my head, and it was technology allows clinicians to function or act at the top of their license, which I think is a very valid statement to make. Maybe you can elaborate on that a little bit more, and then we'll conclude.
Absolutely. So one of the things we know from years of research, right, the American Nurses Association, American Hospital Association, the specialty societies for physicians have done research about what leads to burnout or what allows clinicians to have better resilience. And it really was about getting from under the administrative burden. It was about being able to work at the top of their license. It was about being able to do what they wanted to do, which was to help patients not take notes. And so when we look to apply this technology, it really does take us back to where you're face-to-face with the patient. You're no longer looking down or looking up directly at a screen or over to the side, constantly making those turns and making those clicks. It's allowing you to have that meaningful interaction with the patient. And so that's really what this technology is about. And now that we're going along from generative AI now to agentic AI, it's about having even more tools that are allowing clinicians to expand their reach. And that's going to be incredibly important as we move forward. To the point that was made earlier, we're building more medical schools. We're saying that we're going to have more that are in primary care. Internal medicine is the gateway to every specialty, including nephrology. There just aren't enough clinicians out there. So how do we go further upstream and help our patients be healthier so we're not managing chronic disease, we're actually preventing it? All of these tools, unstructured data that becomes structured that gives us insights will help. And then the other way to do that is to expand the reach of the clinicians that we have now.
Thank you very much. So if there is no any further question, I think that we can close the session. It was very inspiring. Thank you very much for your presentation.